Okay, so this is the second part following up with the first portion of the health history lecture. So obviously, we have to look at cultural implications as well with patients. Different questions for patients that are newly immigrated to our country. What kind of healthcare services did they previously receive? Sometimes a lot of immunizations are different depending on the country that they come from. Or do they have a new provider here? So we kind of got to, look at that big picture there. Obviously, once again, biographical data. We also inquire about any spiritual resources or any religion that the patient may have, because sometimes this may change the treatment plan in the patient. They may not want certain procedures done. There's certain beliefs that may change what kind of care they receive, essentially. If they had any immunizations, because once again, it could be a little bit different, with coming to the United States. Health perception, how do they feel that their health is? How do they describe health and illness? Because this could vary across cultures. So we have to kind of inquire about that too. Does a person feel that they have any current health problems? Is there any difficulty there that they can explain to you? In terms of nutrition, this is another area too, because there's certain cultures that may not consume certain foods. So we always inquire about that with any dietary restrictions or any type of food combinations that they may not want or may need. So we always inquire about areas like this too. This next section is actually for essentially the review of systems. And I'm going to go through this separately when we meet in class to go through each system essentially. For instance, like for breast, we would cover areas such as health promotion. When did they have a mammogram last? Have they noted any changes with their breasts? But we kind of do that with each system essentially. Same thing with respiratory. Do they have a cough? Have shortness of breath? Etc. We're just kind of looking at each, or essentially we inquire about multiple questions under each system. And I'll go through that when we go through a handout during class because it'll make more sense that way. But essentially we go through each system. And as we move through the course, I will also point out those important areas that you have to inquire about for each system essentially. When we get to the older adult, we'll actually cover this a little bit more, but we always have to inquire about the patient's function, whether it's a young child to an older adult. And it does get very important as the patient gets older, or the older adult, because you will start to see, some difficulty with ADLs. Once again, ADLs are activities of daily living. But we'll look at these different areas, such as self-esteem, self-concept, activity, exercise, sleep, etc., relationships, coping or stress, spiritual resources. So it kind of covers all areas. But when we're looking at a functional assessment, we're truly, like I said before, we're looking at the patient's function. How are they functioning? In terms of their daily life, essentially? Or is there anything that's impeding upon their functioning? So that's why we kind of inquire about all these little areas, essentially. And if you were to look in, and I actually put a book up on our Moodle site about functional assessments, but a lot of these also tie in to certain nursing diagnoses. So if you were to look at, coping or stress or sleep, there's a lot of nursing diagnoses that actually will tie into a lot of these functional areas if you look through your textbook, not the assessment book, but like your theory book. And we'll cover that more as we move through. But it's obviously really important to make sure that your patient is functioning, obviously, and there's, interventions that we can do to, essentially help them function better. So these are different areas that we kind of look at for ADLs, and we'll look at this again later in the course too. One other area too, and it depends on your patient, obviously, but usually, obviously when we're doing a history, they typically always inquire about alcohol use or tobacco use, things like that. Um, but if, there's an area where like you feel like there might be, suspicion there that maybe, or they may feel they have an issue with drinking, this is what we typically will add into their health history, and it's called a CAGE test. And basically, CAGE stands for CAGE, and basically C is for cutting down, A is for annoy, G is for guilty, E is for eye opener. So a lot of times the CAGE test will be kind of integrated within there. And it's essentially these questions. Have you ever thought that you should cut down on your drinking? Have you ever been annoyed by criticism of your drinking? Have you ever felt guilty about drinking? Do you drink in the morning? And sometimes called an eye opener. So sometimes this will be integrated within the health history. Obviously, it depends on the patient. Typically, we're not doing this with a young child, but this is what you would utilize for assessing alcohol use, essentially. In terms of perception of health, these are some questions that you could ask your patient to determine their perception of their health. How do you define health? Because health may mean one thing to a patient versus another. Everybody's a little bit different on their views of health, and some patients view it more as an ability to function, or some patients have a higher expectation for their health. So it just kind of varies with the patient. But these are just questions you can use. How do you feel about this current situation or the current health status at this point? What are their concerns? Their concerns might be different than our concerns as a provider, so we really got to listen to our patients and figure out what their concerns are as well, and making sure that we address them. How do they feel about the future? That's important too, because some patients actually will be, being hospitalized can be a very stressful event. And a lot of times they start to worry about the future. And then, if you think about things like depression, et cetera, and stress and all that. But that's just something we ask. What are your health goals? And what do you expect from us as nurses, physicians, or other healthcare providers? Obviously, that way it helps us determine what needs the patient has, essentially. Once again, another question. You could probably read through this one, but what would indicate a substance use abuse problem, essentially? 1, I have a glass of wine each day with dinner. 2, my wife keeps nagging at me to cut down. 3, I love to have a few drinks around the holidays. 4, I have drinks on the weekend when my friends get together. The best one's 2, because once again, we're looking at that where it says my wife is nagging me to cut down. So once again, that's for C, for cutting down. And number 1, you can expand on the PowerPoint, but number 1 wouldn't be a good choice. 1 glass of wine, you really got to look at it too, and it's different between men and women. But a glass of wine each day with dinner, and I know everybody feels differently about this, but we wouldn't really consider that an issue. It's really more about quantifying it and looking at those other areas too. Older adult, once again, the health history is going to be very similar for the younger adult, but we do focus a lot more on their ADL. So, because once again, like I mentioned, normal aging can affect their ADL or their ability to function. You throw in all those chronic diseases, like if they have COPD or they have osteoarthritis. Those are things that are definitely going to affect their ability to perform ADLs. So we do focus on this a lot more in the older adult than we would with like a healthier younger patient. There's no really specific age at which we start to ask these other questions or when to focus on it. It's really using your best judgment. So when you think it's appropriate for the patient. And you got to look at their medical diagnoses and you have to look at their medical diagnoses, with the patient and all that. But you have to recognize, especially in the older adult, you want to make sure you're recognizing those positive health measures. What are they doing to keep themselves healthy? Because at this stage, when they're older, we really do have to make sure that we are almost, not rewarding. I guess, how do I say it? That we're aware of it and making it known that we see that, the positive things that they're doing. It may be walking or them going shopping or doing social activities. So we have to really make sure that, we stay positive too, and not just focus on the negative stuff, but looking at their factors that surround health promotion is really important at this age. Because it can get frustrating, obviously, as they get older. So, we do try to bring out those areas of health promotion in the older adult as well. Older people have spent a lifetime with like the traditional healthcare system, which is really always about defining pathology, unfortunately. If you just think about healthcare and going into the hospital, it's all about, finding the cause and treatment and, that disease state that's there presently. So unfortunately, they've been dealing with this for years. So looking at what's wrong with their health versus focusing on the things that they're doing good too. So it's it's really important to make sure that we are, like, once again, I already mentioned it, that we're actually affirming that they're doing the right things and noting those health strains. Like I said, they could be social factors, just getting out and walking, their ability to perform ADLs at home. So really, we really want to bring out those positive things as well in the older adult too. So instead of just focusing on the negative disease states, essentially. Um, in the older adult, it does sometimes take a little bit longer to get through your history with that patient, because a lot of times too they just want to talk to you, but you learn a lot from them talking to you. Um, Another thing too is that as they age, sometimes they shrug off symptoms, and they just kind of account it to being, getting older, and sometimes they don't even bring it up. So that's why it's important to kind of question and ask those questions, and then sometimes they'll bring it up, or, it'll trigger them to bring it up essentially, because sometimes they don't even bring things up. And pain is a good answer, a good one with this too. Unfortunately, like they view it as a normal part of aging, unfortunately, sometimes, and won't even bring it up until you see them grimacing in pain when they're getting out of bed. And, like that's just an example of when they typically don't say anything. So some older people, and everybody's different, have a conservative philosophy towards their health status, and they may only come for care when there's something really, really wrong. And this happens a lot. Like if you think about a patient with CHF, um, they won't seek care until they're very, very short of breath or like in a dire state, essentially. And not all of them are like this, but it happens. So, um, they've lived life for a long time and have been managing a lot of chronic diseases for a while. So, we have to be aware of that. A lot of them have many chronic problems like diabetes, hypertension, constipation. That could be from meds that they're on, or even as they age, that becomes more problematic. But there's a lot of factors that all can tie into one another or cause other problems. So it can be complicated essentially with them. Um, but essentially, once again, it should be the person's reason seeking care, not our assumption of it. You always want to clarify that and make sure that you're understanding the reason that they are there, what's the current problem that they're seeking, care for. When obtaining a past history in the older adults, you kind of want to focus more on the general health for the past 5 years. You don't want to look at their health and ask them things about that happened 70 years ago. I mean, obviously important things like if they had a surgery or something when they were 45. Yeah, record that. But really, at this stage, we try to focus more on their general health in the past years, 5 years. What are those chronic diseases that they currently are trying to manage? Once again, what are the health promotion things that they, include in their life? Accidents, injuries. So it's really trying to pull up all those serious or chronic illnesses. Hospitalizations are an important area. And a lot of them, you'll find a lot of patients actually write things down, or they'll have a log of, when they were hospitalized or what they were hospitalized for. Operations, you always want to, record the operations that they had, whether even if it was 20 years ago, you want to put that down. But once again, in general, I would say we typically try to focus on that past 5 years, really. We're not going to be recording, that they had bronchitis 40 years ago, if that makes sense. But you also put like their last exam. Do they have a primary care provider? Sometimes they don't even have a primary care provider, so we have to inquire about that. Obstetric status, we do put that down. Like how many children do they have? Are they living? Do they have help? Because that's another thing too. This actually will tell you a lot about their social history as well. Whether if they have assistance nearby. Medications. This is a huge, huge thing. And I'll talk about this again at the end of the class when we get into the older adult. But there's so many room for error with meds, especially the older adult, because they're usually on a lot of meds. So always inquire too. And I always bring this up even with any patient. Like if they came in for an acute issue like blood pressure issues or abdominal pain or what, diarrhea or whatever it may be, always inquire too. Have you started any new medications? Because you'll be surprised, a lot of times a new med can cause a patient a lot of problems. So that's just a side note. But in the older adult, this is a really important area that we're making sure that we're assessing the patient. They take a large amount of drugs. Sometimes there can be confusion. Sometimes different physicians prescribe them. And then they're actually on like overlapping pills that they probably shouldn't be on. So it's always good to do what we call it's a medication reconciliation, but we'll go through all their meds and make sure that they're on, appropriate meds, essentially, not overlapping. It's always good to have them bring in the actual pill bottle so that you can actually make sure that that they're on the right dose. Verifying with family members too if they have someone that helps them. Another thing that you'll find too is a lot of older adults will just stop taking meds, or they'll take a half a pill. They won't take the recommended dosage. And sometimes it's related to financial needs. But that's another important thing to, inquire about. Are they taking it every day as prescribed? But you'll find that happens a lot, that they may decrease the dosage on their own. Or I see it a lot, even my own grandmother, like she'll just stop taking it because she thinks she's having side effects to it. But so it's just an area to look at. Travel may be an issue. Do they need help getting their medications to their home? A lot of times they try to do like self-medication with over-the-counter meds, and you always want to inquire about that because once again, there's over-the-counter meds that can cause problems for any patient. If you think about hypertension, if you take like a decongestant, that can definitely raise your blood pressure. Um, do they share, sometimes too, they share meds with neighbors or friends? Not all of them, obviously, but do they take any medications that they receive from somebody else? So just inquiring about what they've taken in the past 24 hours is another good idea too. Family history in the older adult, it's not as useful as predicting diseases in that patient because obviously they probably have already encountered a lot of disease states at an older age, essentially. So it does help still look at those chronic diseases, and the causes of death in the, close relatives, especially things like heart or stroke, vascular disease. So we still look at that, obviously. But another good area, too, and I mentioned it just previous to this, but it also looks at their existing social network, too. Do they have family that's around them and living? Have they lost recent loved ones? Because it happens as they get older, unfortunately. And we'll talk about this later too, but there's a lot of depression and stuff in the older adult. And, a lot of times you'll find out more things as they begin to talk to you about some of this too. So it kind of opens the door up to, further conversation. Review of systems, it's going to be the same, but you probably will have to add in more things too. Like you think about, they have more, like if you just think about meds, like they can have a lot more side effects with meds in multiple systems just because they're more sensitive to medications. They have a higher rate of, urinary incontinence. So there's a lot of other things that we will add into there, but we'll kind of move through this as we look through each system essentially, and I'll pull it out. Once again, their ADLs, we'll cover this again towards later, but we look at like home and environment hazards. Do they have stairs in their home? Do they have help at home? Can they prepare meals? And we'll talk about this too as we move through the course. But it's basically looking at all these areas, or what activities can they do? Are they driving? There's a lot of different little areas. Once again, just a genogram. I already brought this up. So it's those major things that we're looking for: mental health, diabetes, heart disease, cancers, and looking at the social factors too, especially with the older adult. So that will conclude this lecture on that. Sorry, I kind of went through the second part a little fast, but we will cover, some more of this in terms of, especially like their functional assessment in the class too. So if you have any further questions, please let me know. Thank you.